Hello everyone. Am I audible to everyone? So, Hello everyone. This is Dr. Mansi Tamde. Today I will be taking a class for you on dental materials, that is a revision class. And as I have been informed by the team that today we are going to have some of the students who are going to appear for the exam in next few days, and some of you are new to this means BDS second year. For that, for in that way, I have prepared my today's lecture for you guys, and I am currently pursuing my MDS, that is postgraduate. I am a postgraduate student in the Department of Conservative Dentistry and Endodontics. I have completed my BDS in 2024 in January. So today I will be taking a revision class for you guys. So am I audible clearly? Can anyone just message me once in the comment section? So, moving forward to today, what we will discuss basically dental materials. It is one of the important subject or the core of the dentistry, basically. Then some of you may feel that it is a dry subject, that because of it's not that much like anatomy, that you can imagine some stuff. There is nerve, there is vessels, there is something which is going to happen in this. You are basically going to learn everything about the materials, different materials that you are going to use with time in the dentistry. And this is the subject which basically prepares you for the further procedures or further things you're going to learn with time during your third, during your final years, and during your internship. You're basically going to work. But in second year also, we are getting a means. What I can say is we are using many materials, as in preclinical conservative and preclinical prosthodontics. Many of the materials you use in day-to-day life, like impression materials, you use for making primary impressions, which you use a cast. Then we use gypsum, that is dental stone. Different types of materials you are using in day-to-day life. And then in preclinical conservative, we are actually learning how to manipulate different types of cements. And we are doing the restorations that is in typhodont. Basically we do amalgam restoration, so that is also a way of learning. When see the subject is maybe dry, that could be dry, but it is not like that you will not get to learn anything, or it is not like anatomy, or it is not like physiology. The subject has its core and has its own importance. With time you will develop an interest, or you can say that you will start getting interest in this subject with time. But the thing is, you need to start using it in day to day life. You can't just sit like, I'll learn this materials, I'll learn properties of this, and then I can go and just I can write. If you start thinking of while you're manipulating and like zinc phosphate cement for base, then you should think that why it is being means manipulated on a glass slab, why a cement spatula is used, not the plastic one which we use for mixing GIC. See, if you take things in a practical way rather than in like, I need to do this, I have to do it for the practical purpose. It's not in that way. If you use it in like learning it for the long time, if you use it in that way, you will definitely get interest. And also you will feel that this subject is actually very important with time, and you will realize it in later years. You will see my this statement as a important part of your life later on. So coming to the dental materials, today I'm going to tell you how to study dental materials, then books you can refer, then the time management, how you should means like what time you should give for learning, for reading, and if you are using any app like Identu, how you should use that app and efficiently increase your chances of scoring good and making your understanding more better. Then answer writing, answer presentation, acing exams with good marks, how to read your question paper. That is also one of the important thing that as a student I also face difficulties in the start, that how to approach a question paper. That was also a big question for me. Then importance of previous year question papers. So first, coming to how to study dental materials. See, the part is of two, means we have two parts, that is prosthodontics, some part we have of prosthodontics, and conservative. Both we have different parts. Different materials are used in different, both of these subjects. The section is divided into two. Anyway, if you're going in coming slides, I'll discuss the question paper. You will see that two sections are being divided. So the chapters are also divided in that way only. So it's better to, when you are reading prosthodontic, read it in a way like you are just seeing how the, means if any material like impression compound, then you can imagine when you have used, how you have manipulated it, what was the temperature of the water, which means bowl you used, was it an enamel bowl, was it a rubber bowl, then how you manipulated it, then was, did you, why did you use that gauge piece. Means there are different things you should just think. If you think about that things and then you start learning, it will help you to retain it for the longer time, not for just exam purpose. Then coming to conservative, similarly, when you mix different cements, what was the motion of your mixing, what was, why was the different means we can say mixing instruments, basically why a glass slab is used, then why a paper pad is used, what are the different types of spatula you are using for mixing different cements, then why is amalgam was used at that time, why it was so popular, what was the main characteristic feature which made it so popular among dentists at that time, what is the latest advancement we are using. See, different things you have to think it practically, basically, so you can make a thinking pattern also. Hello, am I audible? Then coming to the books you have to refer. Hello, am I audible? Can anyone please tell me in my chat? Yeah, thanks. Can I start now? Yeah, sure. So hello everyone. Today, sorry, I think there was a technical error. Hello. Okay.
Hi, ma'am, you're audible. You can continue. There's no issue. Yeah.
My previous thing was loaded, no, actually. Do I need to
Yeah, no, it is working perfectly. Yes.
Okay, okay. I'll continue. Yes, thanks. Then coming to the books to refer. See, we all have like books different. We take suggestions from our faculties. Then we take suggestions from our seniors. Then we also see our students in the class, like our batchmates, what they are referring. Everyone has their own level of capacity to understand, and everyone feels comfortable with, like, many other books. Everyone is having their own choices. But what I feel as a person, and what helped me to gain good marks, and as I was a university topper during my time, so what strategy I used for while choosing my books is, I preferably decided to stick to the standard books. So Phillips is one of the standard book that you should definitely refer. Then other book I can suggest is Subbarao. Then if not, in the worst case scenario, if you're not able to get used to these books, or you're not able to adjust to the language of these books, you can go for Manapallil. But the thing is, many facts and many values are not correct in this book. So I would preferably not suggest you to mainly first take this book as your first reference. You should definitely go for Phillips. Then the time management part, coming to this, see, I have a strategy for you guys. See, you need to first, you should definitely go for reading the book once, means the whichever chapter you are selecting, like for example, you're selecting composites, then definitely you should go through at least once that what is the content of that chapter first, what the author or what the writer of the book wants you to know about that particular topic. Then secondly, you should start reading everything from the introduction part. Go in the order, read the chapter. It's not necessary that you should complete the whole chapter reading in one day. Read in small parts. Try to understand what it is going to say. See, if suppose you at least completed the chapter introduction definitions part, then the indication contraindication, it's enough for one day, it's enough. Then definitely go, like I have seen the app of Identoo. In that they have given means they have given nice explanational lectures for the different topics of different subjects. Definitely you should go and watch at least some part of it, so you can correlate that what you have read and what they are trying to explain, like in figure format or in diagram format. It will help you to understand better, make your memory sharper. See, photographic memory always helps you better rather than just reading or rather than just writing. If you just see things and written and means pictorial things, you will remember more better the pictorial things. So definitely you should do that. Then again, after coming that, you can make a second read of that part, so that it will help you to betterly know that no, I am confident with this part. I can now, if anytime someone asks, or if there is any exam, I can definitely write this because I have gone through it twice. Then coming to the do the same things for the next of the chapter or the whole of the chapter. Then the part is, you should definitely prepare notes. Why I'm saying this is, the note taking part everyone should make a habit, because it is the means you are making a, I can say, is replica of what you're going to write your exam. The next part is the answer writing part. I'll see you, tell you that why the answer writing part is correlated with your notes taking. If you make a habit of notes taking, it will be a like time saver for you in the later time when you're going to read the chapters or read the study material again. Also, I have seen the study material that the Identoo provides. That is also very good notes. But every time you can't rely on just the notes from the others. It's better to make your own notes. Take help from that notes also. It will help you to create a very customized notes, which is very easy to retain because you have used your mind in that. You have invested your time in that. That will definitely give you a better upper hand over the others who have just read the book once or twice, or they have just means they have thought that no, once one reading would help me. It will definitely give you upper hand, and it will definitely help you to score better. Then coming to the answer writing pattern, see, uh, in my class I also had many other my batchmates who were like good at means they have good skills of means sharp skills of remembering things for longer time, and they were like they write everything in the format of the book. They were like ratifying everything, but that is not gonna help. I definitely was able to write better because I had more understanding of the topics in a better way. I was able to express that thing in my writing through my presentation. That is the next topic, that is answer presentation. The way you present to the examiner, see, if you have a batch of 100, the 100 people are going to write the same thing. See, the examiner knows that this points, this is the, that is what is written, and he need to check that 100 papers. So the examiner needs to get the attention on your answer sheet. That is what is the benefit, or that is what is the plus point you are going to get if you are having a very good presentation or answer writing skills. A good presented papers, even though the number of pages you use is less, but that will obviously give you the advantage over the others who has not written it in proper format, from proper content. It will definitely give you upper hand over them. Then acing exams with good marks, This is related to the presentation. How well you present your answer, how different type of means clarity in your answer is there, that you are how you are going to the point. Not just quantity is not only way to gain good marks or be the topper or be everyone's favorite. See, quality and quantity both matter. I know that for essay it is a 10 marker, you need to write like 5 pages, but it's not necessary that 5 pages you're writing like anything. If it is organized and it is up to 4.5, the topic needs that much, you'll definitely get good marks, because you have good presentation, you have written what is important in that answer, and you are trying to tell the examiner that no, I have understood this topic, and this what is my way of presenting it, and I have presented in a good way, in the best of what I can do. Then coming to the how to read your question papers. See, I have taken a question paper of previous years. See, the what this question paper shows you. Coming to the all the entries you need to make in your university answer sheet. The time duration is 3 hours. You have just limited time of 3 hours. The maximum marks is 70. The instructions for the students are that you need to answer all the questions. See, even if the subject is dry, the diagrams are less, but there is always a scope that how you can present your answer in a diagrammatic way. Diagram attracts more attention rather than the written matter. If you are good at expressing through diagrams, you'll definitely get more marks than your peers. So make sure that you are making good diagrams. Then section A, it is prosthodontics, and section B is conservative. This is the paper of the dental materials. Then see, they have already written that you need to write both section in different notebook, means different answer sheets they will provide. So be sure that you don't mix up the sections in one or the other. Make sure you're writing first section completely at first and the second section later. Or if you don't remember any one of the question or you have some problem, leave gap for the question and move on to the next after completing that first section. Okay. And the next thing I would like to see is always attempt the questions in the order. Never ever do that I'll answer the last question first or the second last in the first. No, that is a very bad way of answering, because the examiner don't have that much time to check which questions you have attempted, in what order you have attempted. Best is to go order wise. He'll definitely see that no, he has got the answers in this way. It's okay if in one of the answer you're missing some of the points. It's not that big deal, because we all know the subject, each subject is vast, and it's not possible for every one of us to remember every single detail of every answer in the exam. So it's okay, but answer it in a proper order so that the examiner is not frustrated for that small little thing that oof, I need to check this person's answer order, that in for what question he has answered, in which way, in which number. Definitely write, always make sure that you're writing the question number and then the answer in your answer sheet, so that you're not missing, that the examiner don't need to see the which topic and which question number it was given. It's not the examiner's duty to see that. It's your duty to be correct, be accurate, that you're writing the answer for this question itself. And coming to this, then we have the pattern of the exam for you guys are like we have different patterns for different universities, obviously. So my university has a little different pattern, but I have taken the paper from the Kerala University. So this university has a pattern of like essay we have 10 marks, and the distribution of the marks is given at the side. So see, this is very advantageous. This gives you a means idea that okay, the first part of the question you need to write 2 plus 3. That is, for 2 marks you need to define ceramics. So you can write at least 2 or 3 definitions from different standard books like Skinner's, you can say Phillips, then other from prosthodontic, then Nallaswamy. You can write the definition, GPT's definition. You can write that standard definitions for that and properly give a reference for that. Classify them. That was for the 3 marks. You can write 3 to 4 classifications, different classifications about ceramics. Then the 5 marks is for the detailed explanation of the strengthening of the dental ceramics. So see, you are getting an idea that how much marks I need to write. So you can save time by this way. You don't need to overwrite anything. Like the question is define ceramics and classify them. You don't need to like extend it like indications, contraindications, advantage, disadvantage. No, that's not in the question. Give that time to describe in detail about methods of strengthening dental, because that is of 5 marks. You need to gain marks over there. So see, you need to prepare yourself in that way, that how I'm going to approach a question. Similarly, for the short notes, define and explain the steps involved in casting procedures. See, you need the first part, define casting procedure. See, what is the casting procedure? I think this was one of the questions asked by the students. So I'll definitely explain it over here only. What is casting? Why do we do a casting? So starting from this, you need to see it in that way. Casting definition you will definitely learn. This are definition part you need to learn for your exams. For all the chapters I am saying this, not only for this any particular thing. And in that way, when you start, like, what is casting? See, the casting is a procedure in which a object, it's not specifically an object, is formed in a mold. This was the definition given by GPT-8. Okay, but their GPTs are also glossary of prosthodontic terms. This is a full form of GPT. It's better if you write this full form of that. Okay, and ceramics casting definition, you can write one more, which was given by maybe GPT-5. Okay, you can also write one from the Philips. See, this is a procedure. This mainly involves the use of the lost wax technique. What is lost wax technique? See, casting. Why do we do casting is, suppose we are preparing a tooth. What is preparing a tooth? We have done the root canal treatment. Means that tooth now needs a cap. Many of us and nearby also, some or the other people may have this cap and they might have done the root canal treatment. Okay. So once we do that treatment, no, the tooth structure is compromised. The strength of the tooth is little less. So it is not that much strengthful to take the stresses, that is biting stresses, you can say, or any other masticatory forces. It is not that much strong to take that forces. So what you need to do is, we are going to do the crown cutting. Means we are going to give a shape to that crown, means that tooth, and then we are going to take an impression of that, similar to the what you are taking for that in preclinical prosthodontics. We are taking an impression. See, for the edentulous arch, means the edentulous is the arch which do not have any teeth, and dentulous which have the teeth. Both the materials we use are different. So you should know that only the impression procedure I am going to give you a replica of, not the whole. You don't need to use with material, you don't need to use it here. Okay, for this procedure you will take a impression of that prepared tooth portion. After that, you are going to take the cast of that what you have taken the impression of. Then two types of wax means pattern we can take: indirect and direct. This is, in this we are taking an impression, and after that we are pouring a cast, and then we are taking we are making a wax of it. So it is indirect technique, not the direct one. In indirect, we are going to make an impression of that with the wax pattern, and then wax pattern is taken with the help of a sprue. Sprue is like, means suppose if I am I'm eating something, then the food is in my plate. Okay, the plate is what the cast, suppose the food is what the wax pattern, and the next thing is you're going to eat with what? Then you need to have a spoon, then only you can take that food and you can eat. No, so that spoon will form your sprue. That is I can say is it is a wax only. Mainly it is a kind of a soft wax which is sticked over the impression, that is the wax impression, and then we are going to take it out. After that it is taken, the impression is kept aside, and after that it is sent for the casting. Now what is casting? The impression which we have taken, that is the wax with the sprue, that is placed in a sprue former. That is a crucible. That is crucible former. That is a base. That is basically a base made up of a rubber. On that we are going to place it. After that we are going to surround it with a casting ring. Okay, and then we are going to again put a ring liner inside the casting ring. Means the base, inside that is a sprue former, and then the casting ring, and inside that is a ring liner, and the wax pattern is inside. As I have told you, it is already placed on the that is the sprue former of the base, that is that pattern. After that, we are going to put that we are going to invest that pattern, means that whole setup. You have to going to invest with different materials like gypsum, phosphate. There are different materials for different type of means metals we are going to use for the crown. So we have different, any one of them we can use now. I'm just giving a general procedure here. Then the next step you're going to do is we'll see the lost wax pattern. I have said lost wax technique. By doing that, we are putting the that investment inside the ring liner or the casting ring we are going to put inside. Due to the high temperature, we are going to put that thing into high temperature, because we have already put the bonded investment into it. So we are going to put it for the higher temperature. After the burnout, means after going to that high temperature, the wax eliminate. The wax is going to eliminate because it is going to melt away. And after that, we are going to put the metal, means that is the liquid form of that metal. It is the melted form of that metal. We're going to put it inside that, and we are going to again cast it for the next the various casting machines are there, that we have centrifugal force type, air pressure type, different types of we have that machines, and inside that we are going to put it. After the whole of the casting process is done, we will get a ring. Inside that there is investment material, inside that there is the metal which was we have put for in place of the wax. And in the place of that wax, we are going to remove everything that investment we are going to remove, and then we are going to get the crown which we have taken the impression in the form of wax. Then we need to finish polish and everything for that the crown. And this is how the whole of the casting procedure is done. We can place that crown again in the cast we have taken from the patient's impression. We can see if it's sitting properly, if the all of the dimensions are recorded properly. Then if that is good, then we can place it in the patient's mouth with the help of cement or any other material we use to cement the crown. So this is how the whole of the casting procedure is done. Next, the short note is electroform dyes and its uses. Again, 3+2 the marking is given. Different type, then again the questions are different, like adhesion and cohesion, thermal expansion of gypsum bonded investment, composition, types and uses of dental diastone, curing of polymethacrylate, and abrasive agents used in the dentistry. Then the conservative dentistry, we have questions, define composite resins. See, there is a question, add a note on curing light. This is the last part of the question. It is for 3 marks. You need to put, like, you can give what everything about the curing light, how it is different than the chemical curing, what is the means curing lights I can say is what you are using, how much light it is, for how many seconds you are using, different types of things you need to write for this question. Then short notes 2 into 5, that is classify dental cements and mention the uses of zinc polycarboxylic cement, classify inlay wax, describe about the ideal requirements of the inlay wax. See, inlay wax is a common question for both proso and conservative. So you should know inlay wax very well, because it is also used, as I have told in the casting procedure, this is one of the wax which is used. So it is very, very important, and make sure you guys are learning this, because it can be any of the questions you can ask. It can be in short notes, it can be in answer briefly. So make sure you are learning it very well. Then amalgam, obviously it's very important. Classification of the dental casting alloys, it's very important. Gatta Pacha, it's one of the part of the endodontic, means endodontics, and it is given in the materials which we use to fill the root canal. So in that chapter, you will get this question, the answer to this question basically. Classify direct filling goal, it's also very common question one can get. Draw and label cross section of a dental burr. See, this is a question, you need to draw the diagram of dental burr very well. But it's not just about drawing the diagram. You need to give a short brief, like what is a burr, different types of burr, then uses of a burr. At least shortly you should write. It's not like you just directly give a diagram of the burr and you're just leaving. Write it briefly, at least only 1 page. 1 page means just one side of the page, and very well neat label diagram of a dental burr. So this is the 70 marks. The question paper totally consists of 70 marks. This is the distribution of the marks. Then today I'm going to discuss mainly the conservative part. Coming to that, today I'm going to discuss base metal alloys, noble metals, composite resins, cements, bonding agents, denting bonding agents and their generations, dental casting alloys. Then the must-read topics I would like to personally share is glass enamel cements. It's a very common question. The reason behind this is it can be asked in your essay. It is because every examiner, they are like, you should know what is glass enamel cement, taking from the definition to its composition to its manipulation to its types, and what is the latest trend we are going to use. Calcium hydroxide cements, this is also one of the very important. It is also important in BDS second year. It's also important as you reach to the BDS final year internship. It's very one of the important cement. You will definitely know why I'm saying this in the coming years. Dentin bonding agents and generation. This is one of the very, I mean to say, is advanced and very trending topic now. The dentist is revolving around this and composites. So it's very important that you try to understand it in a better way by reading notes from Identu, from seeing the videos, lectures, which the trained faculties and experienced faculties have provided you with the material they have provided. You should definitely watch that. Then dental alloys. Then different types of dental alloys we have. So definitely you should read this all topics in detail. Other than this, I have also shortlisted many other topics. We'll see it in the coming slides. So these are the topics I'm going to cover today. Then the dental cements. First, we'll start with the dental cements. These are the essay type questions I have shortlisted. I will definitely discuss in the, I'll see. You guys know what you need to write, what from where you need to study. You guys definitely know. But how you need to present that answer, I am going to tell you that. The material inside my means this presentation will not definitely be the what you want to write. You can take notes out of it. Either you can take screenshots. Anything will help. But I definitely want you to take a note that how I should present it. You should definitely have your own way of presenting it. That no, this is the method I would like to present. I can give you multiple information. I have means accumulated information from various books. I can tell you the name of the books. I can tell you the name of the articles. But it's you how you need to present. You can read just one book. You can just read Phillips and you can make a good answer out of it. So definitely focus on my content portion. I'll just definitely tell you why you need to write good content, and the rest of I'll just explain it in brief, because you guys know you are going to write your exam. You have read these topics throughout the year. So you just take a note of how you need to present it in front of the examiner. Then short essay questions are zinc oxide eugenol cement, calcium hydroxide sandwich technique, zinc phosphate cement. Short notes, you can have frozen slab technique, setting reaction of the GIC, classification and uses of the zinc oxide eugenol cements, metal modified GIC. Coming to the dental cements. See, suppose a long note comes, then the content is must. The first page of your answer should be very well presented, like you're writing the essay section. So definitely you should present the first page very well. For that, I would recommend personally, as I have used in my university, I hope it's also been right in your university to use two types of pens. That is a black pen and a blue pen. Black pen you should definitely use for the headings. So make sure you're writing the question number, make a margin for your answer sheet, then writing the question number and then the answer for it. Give the heading properly in bold. Okay, double underline it, then write contents, and then you give this all things in that. If the question asks all these things, it's definitely important to write. Say suppose the question is define dental cements, classify them, and write in detail about various cements you use in dentistry. See, this is a short question and you will get it in for the essay pattern. It may be asked. So this is the way you need to write it. First, you need to write the introduction. What is that? Means this is what the content of your answer should be. Introduction, classification, then different type of cements you're going to write in the answer section. These are the different type of cement. Okay. Then coming to the introduction. See, you need to write in a brief way. What are dental cements? Why they are used? Then a standard definition you can definitely write. So these are the materials that set intraorally and are commonly used to join a tooth and a prosthesis. Okay, this is right. I have already told you about the casting procedures. We get a crown, we are using a dental cement to cement it to the tooth. A substance that hardens from a viscous state to a solid state to join two surfaces. This is definitely going to be the definition of your answer. In dentistry, a cement acts as a base, liner, filling material, adhesive to bind devices and processes to tooth surface or to each other. See, this is the significance of a cement in the dentistry. So this line is must, but I am just telling you that this is the way you should introduce your topic to the examiner. That like this is what my topic is and what I am going to say about this question. Then the classification part. I have you taken the classification from various books. You can refer to the classifications with which your faculties or which your teachers are going to tell you that you should write this type of classification. You can definitely use that. I have given this, I have taken this classifications. So these are the two types of classification. In this, water-based cements, powder liquid acid-based cements. Water-based cements in part 2, light activated cements. Zinc oxide, eugenol and non-eugenol cements. Polymer-based filling, restorative and luting cements. Then the ISO classification other, water-based cement, under this we have zinc phosphate and glass ionomer, oil-based cement, ZOE and non-eugenol, and resin or polymer-based resin cements and compomers. Then according to setting reaction, different type of cements have different type of setting reaction. So you should definitely remember the type of setting reaction for each of the cement. Acid-base reaction, polymerizing cements, dual cure cements, tri-cure cements. Classification based on the application. Luting, bases or liners or restorative. See, the differences between this is as a base, we are giving it to protect the pulp. Okay, bases or liners definitely means they are used as a pulp protection agent. Then luting, it is used for the cementation of the prosthesis, like what I have told you in like we are using a dental cement for placing a crown after it is ready. Okay, we're placing the process on the tooth structure. That is for the luting cement we use. Restorative is like we are restoring a tooth. Suppose the tooth is caried, we're removing the carious part, and the restoration we need to do is for GIC. So the mix of your cement should be in that way. Okay, so that is on what basis cement was classified. Then the use of cements. See, the cements can have different uses. So these are the following uses. You can definitely take a screenshot if you want. For long-term restorations, we use glass ionomer, compomer, or metal modified GIC. Temporary and immediate intermediate restoration, zinc oxide eugenol, reinforced zinc oxide eugenol, zinc polycarboxylate, glass ionomer. Pulp therapy, we use calcium hydroxide. Obtundent effect, that is the effect in which the pain is relieved, means if the pulp is exposed at some time, it is preferably that you should give the small part of the pulp is exposed, you should definitely give a cement which will relieve its pain. Liners, calcium hydroxide, root canal sealer, zinc oxide eugenol, zinc polycarboxylate. Okay, these are the different uses of the cement. Then coming to the glass ionomer cement, this is the introduction in this. See, in this also you have, suppose a long note comes, these are the headings you should use. See, introduction is the first, then definition. In this short you need to give it in short, because the part of that question will definitely, the question paper will have the marks. So how many marks you have, but it is important to cover means little part of everything. You should touch the topic. It's not like you can leave something like, no, my answer is only of 5 marks, I will leave the indication content. No, it is important for you to write that also, but it's, you should know the limit. What's the important part, most important part, you need to mention it in your question paper. So the examiner will see that, and he'll definitely know, no, this person knows the concept behind the question what I have asked, and what is the important part he or she need to write. So this is the introduction for it. Then definition according to Davidson. This is a very important definition. You should definitely write this in your exam. Then according to Anisevis, that is the Phillips itself. Then coming to the classification. So introduction, definition, classification. This is the classification according to Skinner's. According to the intended applications, this is classified into 9 types. Type 1 luting, type 2 restorative, type 3 is fast setting liner, type 4 Fischer sealants, type 5 orthodontic cements, type 6 core buildup, type 7 is high fluoride releasing command set GIC, type 8 is GIC for atraumatic restorative treatment, Type 9 is geriatric and pediatric GIC. According to MacLean, Nicholson, and Wilson, this is also one of the classification you can write if you want. But see, this is what I have set it according to me. But your faculties, your teacher would have definitely taught you in some other way, or they might have given you the other classification you need to write. You may have taken the notes. You can definitely go for it. I am just telling you what important thing you should mention in your answer sheet. So you can gain good marks and be in the range of the distinction or above distinction student. Okay, so you should definitely follow your faculties also and make sure you make a decision wisely, that you don't miss out the important things in your answer. Then mode of supply, in what way this GIC is available for us to use. Then composition, this is also very important. You should definitely write the composition of the any cement that is being asked. That is the part where you know how the usage will be decided on the basis of the composition, how the reaction is going on, how what is the composition, what material is present in more amount, what material is present in less amount, where we can use it. So this makes a difference. Okay, so that's why you should definitely write the composition. Then the functions, different part has their own functions. See, if it is coming in a long note pattern, you should definitely go for the detail thing. But if it's not, you can just write two points for each of the component, and you can move on to the next important things. Okay, this is how they have shown function of the components like silica, alumina, fluoride. You can see what they are. Fluoride like lowers the fusion temperature, improves the working characteristics of the paste, contributes to anti-karyogenic effects. Like, this is the important part. You should definitely write it. Alumina, it increases the compressive strength. Then cryolite, it lowers the fusion temperature, increases the translucency of the set cement, and improves translucency of the set cement. Okay, so gives strength. It also gives strength to the cement. The ratio of the alumina to silica is crucial, and it should be 1:2. See, this is also important, but you should definitely mention it after writing the functions. Okay, the increase in the ratio give rise to classes which are more basic and reactive. Reduction in the setting time. This will cause, if the ratio is manipulated not in the proper range, it will definitely give you something which is not proper for the usage. So you should definitely write the means the ratio of what is to what is used. Okay, then coming to the next, which type of liquid is used? It is a powder liquid structure. So we have discussed the powder, and now we're coming to liquid. Then what is the disadvantage of using this liquid? Okay, so different types of advancement obviously comes with time. This is a very old concept, but this is what we need to write in the exam. This is not like, no, this is advanced, so I'll write it. No, what is given in the textbook, what we are being taught, you should definitely write it. But you should be ready for practicing different type of things in your clinic. Once you are going to the clinical part, you should definitely know about the advancement, because that is what is going to help you compete in this competitive world. Okay, then the function of the different acids. Okay, the why this acid liquid reaction. Okay, so the copolymeric acids are irregularly arranged as compared to uniform arrangement of acrylic acids in liquid. This configuration reduces hydrogen bonding between acid molecules and thus reduces the degree of gelling. See, different types of acid have been included. So this helps in reducing the hydrogen bonding, which will obviously definitely reduce the bond strength of the GIC. So it will also help us to reduce the degree of gelling. That is, there was one of the disadvantages, that the gelling is like the consistency of the liquid is too viscous. That is, it is so less fluid that we are not able to mix the powder liquid properly, or the consistency is not proper for us to work. So this will reduce the degree of the gelling. So different acids are been included along with the main liquid. So this is the important thing, how the manipulation is, what is the powder liquid ratio. You should definitely write. Mixed on mixing pad with agate spatula. Again, I have told you about the zinc phosphate, why it is used on a glass slab with a cement spatula. So this is mixed on a mixing pad. Now glass slab is being used on agate spatula, as the cement will stick to the cement spatula. Agate spatula, it is a plastic one. The cement will not stick to this. So it is important that you use agate spatula for mixing GIC. It can be one of your Viva questions in exam. So definitely you should remember that, why we're using a mixing pad and agate spatula. The mixing time for this is 45 seconds. Then coming to the setting reaction. This is a setting reaction, decomposition, migration. See, we have to write it in order. Like powder liquid are mixed, the H plus ion attacks, decomposition of the glass takes place, and the release of calcium, aluminum, sodium, and fluoride takes place. Then what is migration? The acid which we are adding goes to attack the calcium rich sites, and this the ions which are released from that, it goes into the aqueous phase of cement towards the polyacrylic acid chains. See, okay, the next is gelation. The gelation mainly occurs by cross-linking of the polyacrylic acid by calcium ions. See, we have seen as in migration, the calcium ion sites have been attacked by the acid. The gelation is the part in which the cross-linking of the polyacrylic acid is taken by the calcium ions. This cross-linking is mainly by weak ion cross-linking and hydrogen bonds. Due to this, there is a formation of clinically hard surface after 4 to 10 minutes of mixing. Okay. Post-set hardening, it occurs when less mobile aluminum ions replaces the calcium ions, leads to the formation of more rigid aluminum polyacrylate. It occurs within the next 24 hours. See, post-set hardening is done after the next 24 hours. You should definitely know that gelation is the procedure that occurs after 4 to 10 minutes of the mixing. Maturation, it occurs next 24 hours. In this phase, the cross-link medium is hydrated by water and form a hard cement which is more resistant to desiccation and acid attack. The sodium and fluoride ions do not participate in cross-linking of polyacrylic acid. Some of the Na plus means that sodium ion may replace hydrogen ion in carboxylic acid. Remaining ions disperse uniformly within the said cement along with fluoride. So this is how the reaction takes place. This is one of the diagram you can make if you want. This, like, you can draw a rough pencil diagram with glass, and if you can use color, it will be better to distinguish what different molecules you are going to show. So definitely you should take a screenshot if you want to draw it in your exam. So final set is described as agglomeration of this C. This is very important statement. It's very important. It was told by my ma'am also to write this at the end of your setting reaction, because it definitely is what the gist of the reaction is. So definitely you should write, and in this by word to word you should write. Agglomeration of the unreacted glass powder surrounded by a silica gel in an amorphous matrix of hydrated calcium, aluminum, polysaccharide. Okay. The role of the water. If it is a long note question, you should definitely write it. Otherwise, it's okay if you can ignore this part also. Okay. It provides reaction medium. It is essential for the cement structure. Okay. If water is lost from the cement by desiccation while it is setting, the cement forming reactions will stop. Water is an important part. See, if it is not present, it will definitely lead to the hardening of the cement, and the cement mixing means setting will not be in a proper way. It is present in the set cement in two forms: loosely bound and tightly bound. So loosely bound is removed by the desiccation, and tightly bound cannot be removed. It is means associated with the aluminum and polyacrylate bond, so it cannot be removed. Indications: as a restorative material, obviously, as I have told you. In anti-restorations, class 5 lesions, sealing and filling of occlusal pit and fissures, restorations of class 3 carious lesions, restorations of the deciduous teeth, class 1 and class 2. Fast setting lining cements and base. Okay, liner and bases, it can be used. All type of cavities we can use. Dentin substitute. Sealing and filling of occlusal fissures showing early signs of caries. Luting cements, useful in patients with rampant caries in exposed porcelain margins. Crown and processes cementations. Its ability to release fluoride ions into underlying dentine in chemical bonding. Okay. Contraindications are class 4 lesions and fractured incisors we can't use because it does not have that much strength. Lesions involve large areas of labial enamel where aesthetics is of major importance. Class 2 carious lesions where conventional cavities are prepared and replacement of the existing amalgam. And in loss of cusp area, definitely, because it is not meant for taking up that much load. Sorry. Advantages: anti-cariogenic. It is biocompatible. Chemical bond to enamel dentine. Its minimal setting shrinkage. Coefficient of thermal expansion is near about to the tooth. Relatively resistant to acid and wear. Disadvantage: it's a brittle material, low tensile strength, aesthetically less pleasing than composite restorations, relatively opaque and lack polishability. It is technique sensitive and lack of toughness. Then this is one of the question it was asked in the previous year questions, as I have seen. So sandwich technique. The process of restoring a prepared tooth by initially placing a layer of type 2 GIC, that is a restorative one, for fluoride release, followed by an overlayer of resin-based composite for strength and durability. It takes advantages of desirable qualities of GIC, yet provides the aesthetics of composite recommended for class 2 and class 5 restorations. So this is the sandwich technique. You can read it in more detail from the textbook. What it is given from Phillips, it is given in very nice way. I have taken the gist. I just wanted to tell you that this is one of the important question. So you should definitely give it a read before going to write your exam. Then Compoma. This is also one of the question. It could be a short note type question also. Polyacid modified composite or Compoma. It has fluoride releasing ability of conventional GI, that is GIC, and the structure and physical properties similar to that of composites. It undergoes an acid-bed reaction in the presence of saliva. Also, as it has the composite, also has the properties of the composites too. So this is what compomer is. Characteristics: the one paste compomers are present. It can be used as restoratives. Then bond strength is same as GIC, and dentin bonding agent definitely because the composite is involved. Two component luting cements are indicated primarily for cementing of prosthesis. Okay. Then coming to the calcium hydroxide cement, it is available as powder or two paste systems. It is available as dry powder or two paste systems, mixed either with distilled water or saline to form a paste, and it can be also suspended in chloroform and conveyed to the required area with the help of a syringe. See, calcium hydroxide can also be asked as Dicel. This is one of the very popular and very means easy peasy way for the examiner to confuse you. So kindly remember it as, if Dicel comes, don't get panicked. You can write the about calcium hydroxide cement. When available as two paste cement, one paste monomer, the one of the paste is monomer, methyl cellulase as initiator, and calcium hydroxide. The other paste is calcium hydroxide and catalyst. When these two are brought together, the polymerization takes place and the matrix is formed. The pH is near about 11 to 12. Mechanism of action. In this, the mechanism of action is like it acts as a base because the pH is basic. So it will definitely protect the pulp, and any it will not provide any harm to you, the tooth structure, to your tooth structure. And it is also used as different, it definitely has different uses, as we can see, cavity liner and pulp capping agents. Then composition, this is definitely you should write, take a screenshot if you want. Then the setting reaction, this is also important part of your answer. You should definitely write if calcium hydroxide cement is asked to you. Calcium hydroxide reacts with imethyl trimethylene disalicylate ester to form a chelate. Amorphous calcium disalicylate. Zinc oxide also takes part in the reaction. This is how the reaction takes place. Calcium disalicylate is formed. Manipulation, two pastes are taken on a paper and it is mixed to a uniform color. Two different colors are there, then you should mix it to the uniform color, and a carrier is used, ball-ended instrument that is, and it is sprayed in deep areas of the cavity directly over the mildly exposed pulp. It is contraindicated in case of if there is active bleeding, like heavily bleeding if there, you should definitely not use it. The setting time is from 2.5 to 5.5 minutes. See, manipulation, setting time, mixing time, and working time. This is definitely everything you should include in your answers. You can definitely check from the textbook directly to see the accurate what it is given in standard textbooks. Okay. Coming to the zinc oxide eugenol, in this, see, I have explained two cements, GIC and calcium hydroxide. Similar way you need to write for this all cements also. I have given you the contents, take a screenshot and make notes for yourself according to that. So you can definitely get a ready answer for the exam. Like you will read that before the exam and you can definitely go and write it like I know what I need to write, and you can definitely remember things better. See, you need to write introduction, what are the different forms that is available, then classification if there are any, composition, what is the composition of the zinc oxide eugenol, setting reaction for the cement, manipulation as I have already told, setting time, mixing time, working time for all the indication, contraindications and properties. Zinc phosphate cement also same thing, same set of things you need to write for all cements. It's better that you make a proper format and proper answer for yourself in your notes, so that you don't have any worry that I have missed this point, I have missed that point. See, this is all you need to include in your answer, whether it is a 5 mark, whether it is a long note. Definitely you need to include these all points in both type of answers. So this is for zinc polycarboxylate cement also, we are going in the same way. Then coming to the next topic, that is composites. These are the essay questions. This is define and classify dental composites, discuss the composition and properties, add a note on the use of the dental composites. See, this is the whole of the question is revolving around the composites itself. What is dental composite? Then classification, discuss about its composition and uses of dental composites. Then short essay. See, the answer which you are preparing for the long note is similar to what you can prepare for the short note also. Then composition of the composite resins. Specifically, you need to write about the composite resins composition. Short notes, configuration factors, and hybrid composite sandwich technique. More of the questions I have included at the end of this after bonding, because the both our topic are very related, and you will definitely see interrelated questions also. So I have included many more questions at the end of this. So definitely stay tuned. Then the contents are history, definition. For the long note pattern, I'm explaining this. Classification, indications, advantages, composition, then something about each type, because various types of composites are being asked. Then mode of supply, how you're curing. One of the question in the question paper was light curing. You should definitely know about the difference between chemical cure and light cure. I've included that. Properties, clinical technique, that how you're tooth preparing, acid etching, insertion. This part is discussed properly in the bonding part, because that is what that is the technique, that are the agents we use for the composite bonding. Okay, in that part I have then the conclusion. Coming to the definition, this is the definition given by the Skinners. A highly cross-linked polymeric material reinforced by a dispersion of amorphous silica, glass, crystalline or organic resin filler, particles or short fibers bonded to the matrix by a coupling agent. Then this is the classification by the Anusavis, that is also from the Skinner's 11th edition. So this is how it is. I have taken the picture from it, but you can definitely go for the easier classifications, which are just not with this much of material. You can definitely go for easy classification, which are being told to you by your faculties. Coming to the, see, this is the given by student. This is what you can remember easily. Definitely you should write that. Before one is also okay, but the thing is you need to remember more of the things and more of the values. So better is you can use for the easy one. I have just included it for your information purpose. Definitely you can draw a diagram. It will definitely give you upper hand, that you know what size of particles is, what is the where we can use this, where we what is the size, what is the range between the different type of particles are present. Okay, this is how, this is the second, which in which area it is applied, that is whether it is applied in anteriorly, whether it is applied in the posterior region, based on the method of curing: chemical cure, light cure, UV visible, dual cure. Coming to the next, what is the consistency? Based on the matrix, composite based on BIS-GMA, that is what is the which type of means agent is present inside it. Based on that, the classification is given. The indications are in code class 1, class 2, class 3, class 5, class 6 and class 4 also. Core buildups, sealants and PRR restorations, aesthetic enhancement procedures, cements. As cements also it is used for the restorative purpose. Veneering, metal crown and bridges as temporary restorations also at times it is given. Okay. Then periodontal splinting, non-carious lesion, enamel hypoplasia, composite inlays, repair of old restoration, composite restorations, patient allergic to metals. Contraindications are in the areas where isolation is a problem, because composite requires proper isolation, because the steps are it is little tedious procedure, or we can say cumbersome procedure, because the steps are more. And also if there is any loss of isolation in between the procedure, the bonding will be affected directly. As a dentist or as a clinician, as of now, as I'm a first year PG student also, I have done cases of composite. I can say that if there is no proper isolation, the restoration may come out easily if we have not done it with proper steps and proper protocol that need to be taken care of. Okay. Occlusion, when there is a superficial caries or something, we are definitely not going to give composite, because it will definitely create a high point. What is a high point is the patient will feel something is being present over the tooth, like it is being present constantly, and he will feel irritated constantly, that something is touching its upper tooth very constantly, he or she is not able to close the mouth normally as he used to do before. So definitely you should not give it. Then some gingival area, when the caries are at the root surface, you should definitely not go for the uh, composite, because the ability of the composite to stick to the cementum surface is being under means research. It is not definitely proven that it will give you high strength at that position. It may chip off very easily. The hygiene of the patient is very poor, you should definitely not go for the composite. If the caries index is high, you should definitely not go. If the patient has a habit of bruxism, because although it is a strengthful material than amalgam and GIC, but still if the habit of bruxism is there, the composite restoration will chip off very easily. And operator's ability, if the clinician or the practitioner is not very well trained how to do composite, so you should definitely not go for it, because it will definitely compromise the material, compromise the tooth structure, and you will not be able to gain the full treatment or the full ability of the restoration which you are going to do. Okay, so you should not do that. The advantages are, obviously it will give you aesthetics because it is the tooth colored material specifically. It is definitely going to match with your tooth structure. Then it will conserve the tooth structure. It is less complex, insulative, because it is definitely having less chances of micro leakage and all, which were the drawbacks in the case of amalgam and all other restorations. It's used almost universally. See, this is very important as it is very much trending all over the world. Most of the people are using this as their major restorative material. It is strengthening because it definitely has more strength compared to the other materials which we used to use in the past. Bonded to tooth structure, see retention, micro leakage, and staining. These are one of the major advantages of composite, as this all features are not present in composite. They definitely don't stain the tooth. The chances of macro leakage is less, and retentive properties are very good, and you definitely don't need to prepare a proper like cavity or something for getting a good retention. Okay. Repairable, it is repairable definitely. If some of the part chips off, you can definitely repair it by reapplying the etchant bonding, and then you can definitely place the composite. It is repairable. That's definitely, I explained that no corrosion takes place. That does not have any metal. Composition, this is the composition, how composite is formed of. It is formed of resin matrix, inorganic fillers, and coupling agents. Then coming to the resin matrix, it is the BIS GMA. See, based on this, there was a classification given. This is Bowen's resin, also known as, it was given by in 1962. It is also has modified BIS GMA, UDMA. It was given by Foster and Volker. It was given by Bowen, so it is said as Bowen's resin. Then diluent monomers are, these are the principal monomers, these are the diluent monomers: Tec DMA, aliphatic, EGDMA, HEMA. Inorganic fillers, it improves the material properties. Then the benefits of the fillers are reinforcement of the matrix strength, hardness, less wear, less polymerization shrinkage, less thermal expansion, high viscosity and radio opacity, less water sorptions. This is the part which contributes to the aesthetics. Then coupling agents, the types are organosilane, that is gamma meth acryloxy propyl trimethoxysilane, titanates, zirconates. Then this is the diagram showing this. Okay, coupling agents, activator initiator system. Then we have two types: chemically activated and light activated. Then this is the benzoyl peroxide initiator system, which is chemically activated, and the catalyst is aromatic tertiary amine activate. Okay, that is, and p-toluidine, in short you can say. Light activated camphorquinone and organic aliphatic amine dimethyl aminoethyl methacrylate, that is DMA EMA 0.15%, and blue light is used for the activation. Then others are the inhibitors, optical modifiers. Then these are the names for the butylated hydroxytoluene, and it is used where the function of this is basically inhibit the extra reaction or the reaction with the other substances inside the composite material. Okay, this all forms the means like matrix that other reactions are inhibited, then more reactions are inhibited. So that's why these are being added. Optical modifiers, this gives color maybe, At sometimes pigments, the metal oxides are being used. Opacifiers, this is provide radio opacity to the composite restoration. Composite material, titanium, aluminum oxide. Darker shade opacifiers, thin layers, UV light absorbers. See, optical modifiers, basically what a shade, different shades of composites are available. We have different, in population of India only, we had different types of shades. Not everyone is having the same shade. So the amount of optical modifiers in different shades is different. So that's why this gives a color to the composite material. Then the types of composites basically are traditional, microfill, small particle, hybrid. Then this is a short comparison I have included before talking in detail about the composites, types of composite. See, light curing was one of the example, but you should definitely know the difference between chemical curing, as it could also be one of the questions that could be asked. See, polymerization is central. It is very fair in the light cure. Curing takes place in one phase, that is chemically the reaction takes place and the material is set, but it is used in increment format. You need to apply composite layer by layer. You need to cure the composite layer by layer in increments. It is set within 45 seconds as it is in chemical form. The material is set only after light activation. The working time cannot be controlled, it is chemically set, and the working time is under control. Shrinkage towards the center of the bulk. See, the shrinkage occurs because it includes the polymer. So polymerization shrinkage occurs towards the center. Means in chemical format, this is the center. It definitely occurs in the center of the composite. And shrinkage occurs towards the light source, because part by part we are going to place the composite in this. Air may get incorporated, less chances of air entrampment, because we are definitely placing it with the instrument. We are tightly packing it within the cavity with the help of the instrument. So definitely the chances of air entrampment is very less. The wastage of material is more in this case. Less wastage of material takes place as we are going to apply it layer by layer, and we can see up to what level we can apply. But in case of chemical, once we are placing it, the setting takes place chemically, and within 45 seconds it is set. So we are not getting that much of working time, and hence excess material could have been placed by a clinician if he or she is not trained properly. The finishing of the material is not proper. Finishing is very proper. Then the properties, physical, mechanical, and clinical properties, different. This is very important. You should definitely mention it in your answer. So take a screenshot of this. I have just told you just of what properties you need to mention. You can definitely compare it. Like you can tell mechanical properties. See, the remembering value is not that easy, but at least you can mention range of that values. Okay, so definitely you can take a screenshot, and different types of properties are there present. You should definitely write about these things. Many of the properties I have already discussed. Why the means like shrinkage, water absorption, solubility, what is, then clinically, then wear and tear is left, then depth of your chemical and light cure I have explained. Radiopacity, why the radiopacity happens. Compatible, it is biocompatible with the surrounding tissues. That staining is less. Secondary caries chances are very less. Then the integrity is very good with the margins. Then post-operative sensitivity is also very less. Then the conclusion for the composite is most preferred restorative material due to its strength, biocompatibility with the surrounding tissues. Also, it is useful in various aesthetic related procedures. Then coming to the C factor, composites, C factor, it could be a 5-marker questions. Okay, so you should definitely learn this. Composites shrink while hardening. Polymerization shrinkage takes place. This is called as polymerization shrinkage. This leads to the opening of a V-shaped gap if polymerization forces are greater than the bond strength of the enamel or dentine. See, a V-shaped gap is formed between the composite restoration if the shrinkage is higher. So the forces are usually higher than the strength of enamel and dentine, as the composite strength is near about to the enamel and dentine, but it is not exactly same. So the polymerization forces tend to get higher than the bond strength of enamel and dentine. So the what is defined as C factor is the ratio of the bonded to the unbonded surfaces of a composite restoration is defined as the C factor. Okay, it is C, you can see bonded surface to the unbonded surface. The higher is the C factor, the greater is the potential for the bond. What does this mean is कि if the bonded surface are more, the bonding potential will be greater. bond disruption from the polymerization effects. See, if the bonding high as a factor, the more surface you are using for bonding, the more is the chances for the shrinkage, and the more is the chances that the more forces, that V-shaped gap will be created and the bonding will weaken eventually. So this is what the C factor means. These are the different C factor for the different preparations. Class 1, this is the highest risk because 5 surfaces of the tooth or the cavity we are involving for bonding. Class 2, it's 2, these 2 surfaces are being involved. So the strength will be higher and the C factor will be very less compared to the class 1. Class 4, it's of the least risk because only 1 surface is bonded and the 4 are the unbonded one. Okay, so 0.25. The best one is the 0.25 for the class 4. Coming to the bonding essay question is directly the denting bonding agents. Then the short essay question for this is classification of the denting bonding agents. Only the classification you need to mention. 3 to 4 types of classification are present over here. Then short notes, acid etching technique, write about the 6th generation. Any of the generation could be asked, but 6th generation is asked most of the time. So I have given this question in your answers in a question patterns. Bonding, then definitely you should write the content as I have told you for the previous answers also. Introduction, definition, concept of bonding, etching, primer, adhesive, classification of the generations. Then coming to the introduction or definition, bonding, a means of binding two adjoining materials, for example, dental hard tissues, metal, composite, or ceramic, and providing resistance to their separation. Then defining the dentin bonding agent, a thin layer of resin between conditioned dentin and the resin matrix of a resin composite restorative material. These are the definition given by the Anuservice, Phillips. As I remember them, I have read it multiple times, but you should definitely go through and see yourself that I am saying right or not. And you should mention it according to Anuservice at the bottom of your answer while you're writing these definitions. Okay. Then etching, coming to the etching part, acid etch technique. This was the I have given one of the line in this is the problem of that bonding one was overcome by the acid etch technique, which was given by Bunocore in 1955. Then acid etch technique, the process of cleaning and roughening a solid surface by exposing it to an acid or thoroughly rinsing the residue to promote micromechanical bonding of an adhesive to the surface. See, what is micromechanical bonding is, you need to read about bonding in detail. Okay, I have written an answer for the dentin bonding agent, so definitely you don't need to write everything about like what is micromechanical bonding. Only the specific points you need to write, because at a UG level the examiner knows that you are going to write to the point, not everything, like you don't know everything in detail. As you come in final year, as you come in PG in post graduation, the examiner definitely wants you to know the word of the meaning of each word basically. Okay, the acid etch technique together with the application of the current bonding agents is one of the most effective ways of improving the bond and marginal seal between the resin and the tooth structure. So this is a technique in which the surface of the tooth is applied with a gel or a liquid, and by that method it gets roughened, and when it gets roughened it provides a macromechanical. What is macromechanical is the material and the surface will be able to bond like this. It will definitely bond like this, that it will get interlocked between each other. Okay, the bonding will strengthen because the surface of the tooth is roughened, and the restorative material we are going to add, it will definitely penetrate to a better level rather than when it is stick to a plain surface. The different types of etchant are being used. They are acidic in nature specifically. The mineral one are phosphoric acid, nitric acid. Organic one are malic acid, ethylene, EDTA, like ethylene diamine tetraacetic acid. Then the most frequently used one is a 37% phosphoric acid is the most preferred one, and many research have been taken place for that. As a PG student, I can say that. And the mode of action on dentine is, it removes the smear layer, partially opens the dental tubules, provides modest etching of the intertubular dentine. And if you have this time, means if you have the page and if you are writing it in a proper organized way and no you don't have very big handwriting and you are having the space, you can definitely write the procedure in short, that how you are doing the etching process. Okay, the first one is to take the tooth of interest, that is which area you're going to do. You have to apply, you have to clean put water, then dry the tooth, then you need to apply the etchant on the surface. You need to brush it for like 15 to 30 seconds. Basically 15 seconds is the time we use. Then you need to wash it up with the water, then again you need to dry it, but you should not over dry it. That will cause consequences, if you'll definitely understand while you're reading the whole procedure. And then you need to isolate it for the further process of bonding, that application of the second step, that is primer, application of the agent. Primers, as it was discussed earlier, denting agent is highly technique sensitive because the demineralized collagen network is readily collapsed when dried. Therefore, priming is necessary to maintain an expanded collagen network while removing residual water to allow the infiltration of the hydrophobic adhesive monomer. Primers are solutions containing hydrophilic monomers dissolved in a solvent such as acetone, ethanol, water. Such monomers exhibit hydrophilic properties through the phosphate, carboxylic acid, alcohol, ester functional groups, HEMA, shown in the figure, as I will show it in the further slides, is a widely used primer monomer because of its high hydrophilicity and solvent-like nature. HEMA is the most commonly used primer we are using. Primer is basically the agent which is having two sides, that is hydrophobic, which do not love the water, and one is hydrophilic, which loves the water. As the dentin have high content of water, you can read about the dentin, you will definitely know the content of the dentin is so much watery. Liquid means it has more of the water structure in it. So for that, you definitely need a hydrophilic structure, which will definitely bond with the dentin part, and a structure which is hydrophobic, which will part with the resin. Because resin do not loves water, it does definitely will not bond to any substance which has water in it. It will definitely come out. So we need the both side of a agent. So this is the agent which is used for the both sides. Okay, adhesive. For dentin bonding, the primary purpose of the adhesive is to fill the interfibrillary space of the collagen network, creating a hybrid layer on resin tags to provide macromechanical retention upon polymerization. See, this is the agent which is used for the adhesive as a joining part of the resin and the tooth structure. Okay. In addition, adhesive layers also prevent fluid leakage along the restorative materials margins, since they make up the major part of the intermediate layer between the dentin or enamel and restorative composites. Similar classification of the agents. These are based on the generations, that is first, second, third, fourth, fifth, and sixth, seventh. Then based on number of steps, that is whether it is single step, 2 steps, 3 steps. Okay, etching technique, total etch or self etch, and one more is based on the smear layer removal, but that is not as of required during your UG time. So it is a classification which we generally read and which we should definitely know as a postgraduate student. Okay, coming to the generations, I have given everything in brief. So definitely, if you have more points or if you have a better way to write any of these generations or all of these generations, you should definitely go for it. I've given a brief because I need to discuss the topics in brief. First generation, the mineral acids were used, and they use glycerophosphoric acids. Okay, and the hydrophilic part reacted with calcium of the hydroxyapatite. Hydrophobic methacrylate part bonded to the acrylic restorative resins. Okay, the main disadvantage was it didn't have the good bond strength. Okay, and the coefficient of thermal expansion was also high. Second generation, it has been replaced by acrylic restorations. Okay, one system used NPG GMA. It was proposed by that the NPG portion bonded to the calcium of the tooth by chelation. Other products were phenyl P. Different materials were used in second generation. Okay, the bond strength was still low, and the adhesion was short term, and the bond eventually hydrolyzed. The example were Prisma Universal Bond, Clearfill Scotch Bond. Third generation, this were a serious attempt to remove the smear layer. As I have told you, the smear layer is one of the important part of dentin, you can say. So it was major part which was causing a hindrance or causing a problem to bond to means like the bonding of the restorative material with the tooth structure was being hindered by this layer. So the attention was given to this. The bond strength of the third generation materials were near about to the resin, to that of the resin to the edged enamel, that is to the surface of the edged enamel. The bond strength improved from that of the second generation, 12 to 15. and the more complex, and it required 2 to 3 application steps. Okay, etching of the enamel with 37% phosphoric acid, conditioning of dentine was done with mild acids, application of the separate primer was done, application of the polymerizable monomer, and then the placement of the resin. The examples are Tenure, Scotch Bond to Prisma Universal Bond, Mirage Bond. For generation 4th, because it was important, means it was able to get better bonding in this because of the total etch technique and the development of the hybrid zone. The acid etching of the dentine definitely did not particularly cause harm to the pulp, and also the bacterial contamination, macro leakage was also avoided. Thus, the total etch technique was introduced. It was given by Nakabayashi. So the hybrid layer concept were also given by the Nakabayashi and Fusayama. It was a very important concept. Okay, and the hybrid layer is defined as a structure formed in the dental hard tissues in enamel dentine cementum by demineralization of the surface and subsurface, followed by the infiltration of the monomers into the collagen mesh and subsequent polymerization. Examples are Allbond 2, Scotch Bond, Multipurpose, Optibond. 5th generation, it was used because of the clinical complexity and multiple steps of the 4th generation of the dentist began asking for more simple adhesives. The 5th generation combined the primer and adhesive into one bottle, self-priming adhesive. The examples of the generation are single bond, one step, prime, and bond. The advantages are it reduces application steps definitely as compared to 4th generation, less technique sensitive as it can bond to moist dentine, less volatile liquid, pleasant odor, and higher bond strength as compared to that of the 4th generation. 6th generation, it was introduced in the mid to late 1990s. A separate etchant was not required. It was 2-bottle system, type 1, 2-bottle, 2-step. Etchant and primer are combined in one bottle called self-etching primer. Other bottle contains the adhesives. The examples are Clearfill SC Bond, Adhesive, Optibond Solo Plus. Type 2 were 2-bottle, 1-step system. Liquid A contains the primer, liquid B contains a phosphoric acid modified resin. That is self-etching adhesive was used. Both liquid are mixed generally before the application. And Xeno 3, Adfor, Prompt, LPOP, Tenure Unibond were the examples. 7th generation, early 2000 attempts to combine all 3 etchant, primer, and adhesive into a single product. Thus, 7th generation adhesive may be characterized as no mixed self-etching adhesive. The examples of the examples include iBond, Xeno 4, ionomer based. It was ionomer based, Clearfill S3. Unfortunately, the 7th generation was not that much efficient as compared to that of the previous generation, so it was not that much used. And then the indications of the bond agents are for bonding composite to the to structure is an important one. It was used for the composite bonding to the porcelain and various other metals to base metal and noble metal alloys, desensitization of exposed tooth surface and root surface, and bonding to the porcelain veneers. Then contraindication bonding should not be done immediately after bleaching a tooth. It is advisable to wait at least a week following the procedure. And this is the whole of the procedure of bonding of an composite to the tooth structure. This is the acid etching application of the gel, that is minimum 15 seconds. Then it is the dentine is also etched. Then it is rinsed with the water. Then applying of the bonding agent, it is left for the 20 to 30 seconds. Then the excess of the excess is once dried but not over dried. Then this is a light cure. The bonding agent is light cured once. Then the composite is being applied in the incremental level. Okay, and the light cure is being done for this. Then the finishing of the polishing of the composite restoration. So this is the whole procedure, how bonding agent helps in the restoration of the composite. This is a definitely very good picture. You can draw it. It will definitely give you an means upper hand over the other of your peers. Okay, you should definitely take a screenshot of this. Then other important topics you should definitely read is the sandwich technique. Okay, I have briefly discussed this in GIC, but you should definitely read because it is a common for both the GIC and composite chapters. Okay, should definitely give it a read. Flowable composites, this could be a short note question. Core buildup composites, microfield composites, hybrid composites, geomer, light curing of the composite. It was one of the asked questions. Okay, coming to the casting alloys, describe about various dental alloys and its composition, uses, advantages, and disadvantages. The short essay questions are base metal alloys, classification, composition, action of ingredients, advantages, disadvantages. Classify base metal alloys, mention about stainless steel, cobalt, chromium, nickel, beta, titanium alloys. Use of base metal alloys, beta titanium alloy. Desirable properties of casting alloys. Okay. Coming to the contents, introduction, definition if there is any, history of the casting alloys, then classification, properties of alloy, noble metal alloys, base metal alloys, and metal joining procedures, and conclusion. Introduction. Metal restoration and processes are an integral part of the dentistry. Metals are among the strongest materials that provide strength, durability to any structure. Today, the dental profession has access to a wide variety of casting alloys. These alloys are designed for specific clinical purposes like inlays, onlays, crowns, bridges, partial dentures, and fused metal restorations. Then the definition. An alloy is defined as a metal containing two or more elements, at least one of which is a metal, and all of which are mutually soluble in the molten state. Noble metals have been used for inlays, crowns, FDPs because of their resistance to corrosion in the mouth. Gold, platinum, palladium, rhodium, ruthenium, iridium, osmium, and silver are 8 noble metals. However, in the oral cavity, silver can tarnish and therefore is not considered as a noble metal. Base metals. These are the noble metals. They are important components of casting because of their influence on physical properties, control of the amount and type of oxidation, and their strengthening effect. Such metals are reactive with their environment and referred to as base metals. History, the lost wax process, as I've already explained it in the start of my presentation. In the classification of gold-based alloy was given in 1932. Cobalt, chromium, and nickel chromium alloys were given in 1933. Porcelain fused to metal processes were given in 1959. And 1998, the Clean Air Act was introduced. Classification, according to the use, alloys for all metals and resin veneer restorations. Example, inlays, post, resin, and composite. Veneered crowns and FDPs. Alloys for metal ceramic restorations. Example, PFM crowns and FDPs. Alloys for removable dentures, example, RPD frames and complete denture bases. Based on the yield strength and percentage elongation, type 1 soft, type 2 medium, type 3 hard, type 4 extra hard. According to the nobility, high noble metals, noble metal alloys, predominantly base metal alloys, and base metal. This is the classification. The classification is popular among manufacturers based on the amount of that we have, that is what amount of gold we have, what amount of noble metals we have together. Okay. And for according to the nobility, high noble metal, then it contains more than 25% of the noble metals, contains less than 25% of the noble metals. Okay. Then according to the number of alloys present, that is binary 2 elements, ternary 3 elements, quaternary or so forth 4 elements. Okay. Then requirements. What are the basic requirements? They must not tarnish or corrode in the mouth. They must sufficiently strong for the intended purpose. They must be biocompatible, non-toxic, and non-allergenic. They must be easy to melt, cast, cut, and grind. They must flow well and duplicate fine details during casting. They must flow well. They have minimal shrinkage on cooling after casting. They must be easy to solder. That is the metal joining procedure, one of the metal joining procedure. Then coming to the noble metal alloys, the periodic table of the element shows 8 noble metals, that is gold, platinum group, platinum, palladium, rhodium, ruthenium, iridium, osmium, and silver. However, silver is more reactive in the oral cavity and is not considered as a noble metal, as I have already mentioned. Then coming to the gold, see, I am going to explain what are the base metal, noble metal alloys. Then I'm going to tell you about the properties of that. Then based on this, there are the alloys, a different combination of the alloy. Alloy is basically a combination of two or more metals. Okay, so this is what we are going to see. Gold. A soft yellow metal is the most ductile, malleable of all metals, but it has much lower strength. The density is 19.3 gram per centimeter cube. Melting point is 1063 degrees Celsius. Resistance to corrosion, high burnishability, low yield strength. Then platinum, it is a bluish white metal, is tough, ductile and malleable. Its hardness is similar to that of copper. Density is 21.37 gram per centimeter cube. The melting point is 1755 degrees Celsius. Okay, the highest elevation elevates fusion temperature, elevates strength, whitens the alloy. Okay. The palladium, it is a white metal. It whitens the alloy. Any gold alloy containing more than 6% of palladium will be white. Density 11.4 gram per centimeter cube. Melting point 1555 degrees Celsius. Enhances mechanical properties such as hardness, tensile strength. Okay. Then these are the other metals which are available. Okay. Iridium, ruthenium, rhodium. Then base metal alloys used in dental alloys include silver, copper, zinc, indium, tin, gallium, and nickel. It is basically used in fabrication of the partial denture framework as casting and wrought alloys, surgical instruments, and periodontal splints. The base metal alloys for metal ceramics include nickel chromium, that is nickel based alloys, cobalt chromium, pure titanium, titanium aluminum, vanadium alloys. Advantages and disadvantages. The various advantages are lighter in weight, better mechanical properties, it is corrosion resistant and less expensive. Disadvantages are more technique sensitive, complexity in production of dental appliances, high fusing temperatures, extremely hard, so requires special tools for finishing. The high hardness can cause excessive wear of restorations and natural tip contact in the restoration. Nickel chromium alloys, this is the composition you need to write. Okay, nickel is this much percent, chromium is 11.27%, molybdenum is 2 to 9.8%. Properties, different properties you should definitely mention. Like you can see what range of properties I have mentioned. You should definitely mention this all properties. Color, melting range should be that. Density 7.8 to 8.4 gram per centimeter cube. Hardness is 175 to 360 VHN. This is the unit for hardness. Yield strength 310 to 828 MPa. Varnish is highly resistant, soldering important for joining. Other important topics are titanium-based alloys, stainless steel, cobalt, chromium. Now, this could be a short note question also, so you should definitely read these topics from the chapter of casting alloys. Okay. Then other important topics from the other chapters are casting procedures, gypsum products. You should definitely read casting defects, die and its properties, inlay wax pattern, and definitely what is casting. It could be a long note question. Tarnish corrosion, tarnish and corrosion. This could come as a short note question. Electrochemical corrosion as a short note, specifically in other part. Cavity liners and varnishes, liners, bases and varnishes, it could be asked a short note. And different types of means the question could be formed in different way also, along with any other question also. Okay. Then the brazing and welding, that is the procedures we use for joining metal. Brazing, welding, soldering, flux and anti-flux, these are the important questions from this chapter. Basic properties of dental materials, stress and strain, strain hardening, metamerism, fluorescence, elastic modulus, yield strength, then 3 dimensions of color, that is hue, value, and chroma. Amalgam, we have amalgam, setting reaction of amalgam, high copper amalgams, mercury hazards, admixed alloys, and Eames technique. Then direct filling gold, we have gold foil, foil forms of DFG, classified DFG. Okay, dental ceramics, methods of strengthening ceramics, glaze in ceramics, castable ceramics, CAD/CAM. Then this is the end of my presentation. I hope I have told you what to write in your exams, and definitely the last few slides in which I have mentioned different types of topics, you should definitely go through them to learn everything and write properly in your examination. I would like to ask the host to kindly tell me what next I need to do. If there is a session for students to ask doubts or something.
No, if they have any doubts, they'll be like asking in the WhatsApp group.
Okay.